Good afternoon, everybody. Thank you so much for being here. And I think I know most of you. I recognize most of the faces here. Some new ones. Kim, that's your son?
Mikey.
Yeah. Mikey. Thanks for coming, Mikey. We hear about you guys a lot, so it's just great to get a face to the name. So thanks for coming. You know, as most of you already know, we have a team of clinicians here, and we're adding to our team as well this year. And before I start the presentation, I want to get a chance to introduce the team members that we have here that are here present. They're not all here, but the ones that are here, I just want you guys to get a chance to see who they are. So I'll give them just a second to kind of gather. But obviously the topic of today's presentation is dysautonomia. My name is Dr. Cedrick Noel. Dysautonomia is a topic that most people don't know about, but more and more people have heard about and are learning about because there is a growing number of people in our circles, in our population, that are being diagnosed with some form of dysautonomia. And unfortunately, the care available to help those people is not adequate. And really, a lot of that is just the result of, you know, the learning curve not really catching up quick enough. You know, we obviously, if I go back a year from now and I look at what we're doing today compared to a year ago, there is no comparison to how much better we are at treating it. But overall, it hasn't really caught up in general practice. And doing these videos is a way of showing to the public that there is a solution. There are numerous clinicians in various places that are very successful with it, and we want to talk about what we do, and of course we'll talk about what it is. But it's really a condition that we should all know about because the autonomic system is that system that controls all vital functions in your body. And like anything, there's a spectrum where there's the dysautonomia spectrum, which is more extreme. But what if you're pretty early in that process, you don't have symptoms that you're necessarily associating with an autonomic imbalance, but what if you have it and there's something you might be able to do to prevent more problems? And so for that reason, I think it's really great for everyone to listen to this presentation. So, but before I start, I'd like to introduce you some of our team members that are here: Jennifer, Kendra, Dr. Elaine, and if Dr. Ben's around, he can come on back too. And if you're a team member and I didn't see you, you're welcome to come on back. So we have a clinic here that's set up as a multidisciplinary office, but every person on our team is here because they embrace that brain and body model. So it's a brain-based care or approach to care. And thank you. And so we have different practitioners that specialize in different specialties. And Kendra Noel is my wife, and this is obviously a dream of ours and other team members here to create this environment in this clinic. But I just want Kendra to say hello and introduce herself kind of briefly.
Hi. I don't know if this is on. Kendra Noel, we're so glad that you're here. Very thankful that you're here. And I'm an occupational therapist here. I work with pediatrics and adults, and I mainly do hand and upper extremity rehab from a neurological and orthopedic perspective.
Yeah, and a lot of you probably have met Kendra because she's often helping me for sure in a lot of different places. So she does way more than her specialty, but she's been a very experienced practitioner and in the field for a very long time. And so thank you. Yeah. You'll see her again because I'm going to use her as a model. And this is Dr. Elaine. Dr. Elaine and I have known each other a very long time. You want to hold it?
I'll
Yeah.
hold it.
Dr. Elaine is a naturopath, and I'll let you introduce yourself. But I just wanted to say that we've seen many patients over many years that we've worked together with. And so that was having naturopathic care here has been something that we've always wanted to do, but it just hadn't happened until now. And Dr. Elaine is here, and I'll let you introduce yourself, say a little something.
Thanks, Dr. Noel. And I said, it's such a blessing to be part of this wonderful team. I'm going to be starting here on June 1st. I specialize in functional medicine, naturopathy, vitamin deficiencies, and one of my specialties is unknown infections, things like that, that are causing imbalances in the body. So it's getting to the root cause of what's wrong. And I look forward to meeting you and helping you.
Thank you.
Thank you.
And those unknown infections, they're often at the root cause of many dysautonomias. So a lot of times we frequently have to work together on these cases. So, Jennifer? This is Jennifer Novak.
Hi, Jennifer Novak. I'm a mixer of kinesiology and biomechanics and energy work, and I work mainly to get people over those struggling things that maybe you've been through physical therapy and you still haven't resolved the issue, but I also work with a lot of brain-based problems. I was here all morning working with a stroke survivor and someone who is on the autistic spectrum with mold exposure and PANS and PANDAS, and a third person who had a brain injury. So, but it's all about how or if you're processing the information from your body, how your brain takes it and gives you the proper output to keep you healthy and strong.
Thank you. Dr. Ben?
Thank you very much, Cedric. It's great to see everybody here. I'm glad you guys were able to come out to Dr. Noel's lecture. It's going to be a good one. Buckle up and get your seats ready. So, Dr. Ben Barrett, like Cedric, we're all very well qualified at a clinic. We have a lot of advanced certifications. I'm triple board certified in functional neurology, head injuries, and vestibular rehab, and a chiropractic neurology diplomate, and a master's in physiology. So, working with the body, here at Brain and Body, as of Cedric, we provide very individualized care and approaches to people, to whatever concerns going on. That way, the person is able to get better faster, quicker, and we don't leave things up to guesswork. We know what's going on, we know how to treat it, and we know how to approach it so that you are getting back to what you want to do, life. There we go.
Give it to her. Oh. Thank you, Dr. Ben. And so much of what I've learned, Dr. Ben and I have known each other a very long time, and we've had numerous conversations over the years about creating a facility like this, and it took many years of trying to plan it and make it happen. But so much of what we do in here, there are many clinicians in our group that really earn the credit for bits and pieces of everything that we put together. So I certainly don't deserve all the credit. It's really, the environment that we have in here fosters a lot of learning from great minds, and being together is what makes that possible. So, well, let's begin. So we're going to talk about a brain and body approach to the autonomic nervous system. And it really, the reason why there's, in the title I talk about the cardiovascular system and the digestive system, is because we're often talking about and think about these conditions as completely separate. Well, there's a brain issue, there's a digestive issue. But the reality is that they are deeply interconnected. My story is one that, early, well, I have a lot of health stories, but one primary story that I like to refer to that has really helped me understand neurology the most is my own experience with concussions. So in high school, I played college hockey. No, high school, I played high school hockey, and then I went on to play college hockey. Anyway, I played a lot of hockey. High school and college, very competitive level, with a mechanical valve. So I was born with a heart defect. I was the guy that couldn't run from there to there without feeling like my heart was going to explode. And now I can do really everything without limitations. I feel like when I run or when I skate and I play hockey, it's not my heart that stops me. It's more, maybe legs or muscles are getting tired because they might not work out enough. But it's not a running out of breath kind of situation. But my story from high school is that I had a concussion. I didn't know that I did, but I had one. And this is back in the days where you just live with it, right? No one was talking about it. But that's from that point on that I noticed a series of issues, and one of them was concentration, focus, of course, headaches, muscle tightness and in very specific patterns. But what I noticed is that over time I was starting to have issues with my digestive system. And it all happened after. Not just focus and concentration, but now I felt different after a meal than I did before a meal. And so there's a connection there. And of course it took me many, many years to make that connection. But my story is one that I like to use personally for learning because I was always out of energy. I never have had enough energy to just read a full paragraph, of anything. And so now it's the exact opposite. So as I get older, I have more energy and I have more endurance and versus when I was younger. And that could be, that could be you in a lot of cases. Of course, there's limitations in each individual, but for the most part, if we can help improve this connection between the brain, the heart, and the gut, your life will be very different and much better. So we teach a lot here. Obviously, we're launching our community lectures. We've done a number of them already, but our intent is to do them on a regular basis. We're trying to do one a month, but sometimes we may miss a month here and there, or occasionally we may have more than one a month. But we also teach clinicians like ourselves because our methods are truly cutting edge. And that's what I hope that you get to see. I brought some props up here and of course through the slides. I'd like for you to see what we're doing for dysautonomia because it is amazing. It needs to be shared. The effectiveness is very high, and this is a condition that I used to not want to see. Not because I didn't like people. I love people and I love to help people, but I love to help people that I can help. And dysautonomia was one of those things where my success rate was low. I helped some, and I didn't help many. Until now, I feel like it's very high. Still, we can't help everybody we see, but a very high percentage do really great. And there's a reason for that. And so we're teaching on this topic to clinicians in November. So about twice a year, we have seminars in this facility for clinicians. I love this picture right here. And so you heard my story, and obviously the reason why we're here today is because our approach is changing lives, and we see evidence of that change very quickly. It doesn't need to take months to be like, okay, it didn't work. No, we could see evidence of positive trend of change same day, within a few days, within a few visits for sure. If it's going to work, we're going to know. And I'd like to read this verse here. I actually read that this morning, and it made me think about what we're talking about here. Because obviously, we all know that there's a vascular specialist, there's a neurological specialist, there's a digestive specialist. That's how medicine is set up. But the reality is that in order to help someone with dysautonomia, you need to know all of those specialties and bring them together. And so in Romans 12, verse 4-5, it says, "For just as we have many members in one body, and all the members do not have the same function, so we, who are many, are one body in Christ, and individually members one of another." So the heart and the gut are members of one another. The lungs, the heart, are members of one another. Okay, so there's strong connections between these systems. If you disconnect them from the brain, they're not going to function. With the exception of the heart, it has its own internal pacemaker. However, it is designed to be influenced and controlled and modulated by the brain. And that's the vagus nerve. That's one of those nerves that most people have heard about that has strong impact and control and modulation of the brain in terms of heart rate and stroke pressure and all those things. So there's a lot of interconnection between the brain and the heart. This is a great research article. As you'll see near the top, it's very new, so it's published for the first time in April of 2023. And so when it comes to the autonomic nervous system, and we talk about dysautonomia here, but I'd like for you to think about everything that it controls. And we're going to talk about that a lot today, but everything that it controls, well, is everything. So it controls the immune system. It has an impact on the vascular system, on the respiratory system, on the digestive system. All these things, these functions, these parts of our body that the brain controls that we don't voluntarily control. All right, there's no voluntary control. It's an autonomic control. That's why it's called the autonomic system. Well, in this article, it talks about the central nervous system and how it can affect tumor development and metastasis, and how the central nervous system plays a role in cancer. And then later on, it talks about how targeting the dysregulated peripheral and central nervous system might be a good strategy for next generation cancer treatment. And so, you know, cancer cells are not uncommon, right? We all have them. We all have cancer cells in our bodies, but we have an amazing immune system designed to remove them, to destroy them, and to remove them. Well, if that system's not working well, then that's when cancer starts developing. Well, which part of the brain is responsible for that system? And then again, we're going back to the autonomic system. And so, as you've probably seen on your surveys, at the top there's a question that says, would you like to do a free autonomic assessment? We have a computerized machine, really a computer that has sensors that we can actually monitor and measure the autonomic nervous system. The name of that program is Nerve Express. It's heart rate variability testing. And there's different kinds of heart rate variability assessment tools. But this particular one, as I'll talk a little bit more about later, gives us tremendous information that can really give us great insight on what is the state of your autonomic nervous system. Is there potentially a problem there that you may not even know about? So we're offering that for free. So if you are interested in doing that test, we have sign-up sheets in the back. You can wait till the end, or you can go sign up during the lecture if you want. But there's slots that are open. Just pick a slot that you want to. Those are the only times that it's offered for free. If you can't make it at any of those times, you're welcome to come back at a different time, but it won't be free. Okay? So the autonomic nervous system, I think I've already mentioned a lot about what it is, but there's different divisions within the autonomic nervous system. And its primary functions that most people can relate to are heart rate and force of contraction, digestion, respiratory rate, pupillary response, urination, sexual arousal. And so it's interesting because when we mostly think about the autonomic system, we think about the heart and digestion. There are other autonomic functions as well. I won't necessarily spend a lot of time on those, but if you have some concerns about other things that we may not necessarily talk about and you want some more answers on, you feel free to reach out and we can elaborate on those as well. And I'll keep all the questions for the end if you don't mind, so that way we can get the presentation done in a timely manner. There are numerous reflexes associated with the autonomic nervous system. Breathing is one of them. The control of the diameter of blood vessels is another. And this is a big one because, you know, lately we've had a number of people with high blood pressure who we've worked with and tried to balance that autonomic system and help support it. And there's a particular product that we have. Let me grab it. I'll have a little bit more on that later, but this is called Anginox, and this product's job is to help your body produce more nitric oxide. You need nitric oxide to relax blood vessels. And so in some cases, I don't want to say every case of high blood pressure, but in some cases, because that's too deficient, you need to replenish it to allow for proper relaxation of that arterial diameter. And we have seen many people do really, really well with the combination of our approach and taking Anginox. So I will be giving away some of these things, these products, as I talk about them in the lecture. So if you haven't filled out one of these little tags, I know I see them in the basket there, but if you didn't get to fill one out, when we do a drawing and you want to hopefully win something, make sure your name's in there. Because we'll be giving away about 5 or 6 different products. Coughing reflex, sneezing, swallowing, vomiting, heart rate control, those are all functions of the autonomic nervous system. This is a busy chart. We have this chart in our office in various rooms. The reason why I want to put that up is just to make you realize when I talk about the brainstem or when I talk about the autonomic nervous system, we're relating to this part of the brain. It's red, blue, and green. This is a magnified version of the brain from the front. Not to scale, we magnified the brainstem to show that there's these 3 sections. The reason why I want you to see that is because that is the control center of the autonomic function, okay? And this is what we need to look at. This is what we need to assess when there's an autonomic problem. Some of the common issues that can result from a dysautonomia are going to be arousal, so wakefulness. When that red section there, that's that fight or flight system when it's too active. When this red section here is too active, it'll be very hard to sleep because you need a good balance between the red and that blue-green region. If we just separate it in 2, the red and blue-green, they need to be in balance, okay? And if that blue-green area is too deficient, your posture will start shifting like this. So that's one of the clues that we get when we look at someone's posture is, what's this anti-stress region like, right? What's this rest and digest region like? Well, if you're here, now there could be other reasons for being here, but generally it's pretty accurate to say that it's probably not doing great. Therefore, it affects blood flow, it affects restfulness, sleep, vascular oxygen delivery. A lot of times with these kinds of conditions, we have anxiety and migraines and headaches and things like that. We'll talk a little bit more on that. But also, turning down pain comes from the brainstem. That's why all 3 colors are in there. I'm sure you've heard of serotonin, dopamine, norepinephrine. These are neurotransmitters. They're produced in the brainstem. So pretty important, right? So when we do these assessments and we look at brainstem function, we assess for autonomic function using the Nerve Express, that test that we were talking about. We're really looking at this area and seeing, is there any reason to be concerned about that area? Is there a big problem? Is there a little problem? And I'll show you what that looks like when some of these findings come up. But that kind of gives you an idea. What if there's a lot of depression, maybe serotonin is low. Norepinephrine, serotonin are very much alike. So between these 2, you'll see there's a lot more blue and green if you add them up together. So that blue-green region is just really, really important. So if we've got this posture and we've got some anxiety, some depression, that you know that there's an imbalance there. There are, as I mentioned earlier, divisions of the autonomic nervous system. And just hang with me a little bit through the beginning. It's going to get a little bit more exciting as we go along. It won't be rough and dry the whole way. But there are 3 different divisions within the autonomic nervous system. The sympathetic nervous system is that fight or flight system. Have you guys ever heard of the fight or flight response? Yeah. Okay. Have you guys ever felt it? I mean, it just feels like we're a lot more stressed out than ever as a population. And that is probably the #1 indicator of an imbalance within the autonomic system, is feeling like stress is high and I can't handle it. We have the ability internally to handle stress. We have a system that helps to kick in and inhibit these responses and control them. And that's primarily that parasympathetic nervous system That's the braking system. That's that rest, digest, feed, breathe, rest, and digest, okay? That's that parasympathetic nervous system. That's that blue-green area. Remember, there was red and then blue-green of the brainstem. That's the number one, I guess, the networks within that blue-green region, one of their top responsibility is to engage and activate that parasympathetic nervous system and to calm down heart rate, promote better respiration, and just, optimize all these functions. That's what allows you to live a long, healthy life. And to have a ton of stress and be like, I'm good, I can take it on, doesn't affect me. Okay? And that's also what allows you to sleep at night. And then the enteric nervous system is the other branch, and it governs function of the gastrointestinal tract. And so I added in another one in there, and it's not an official branch, but I think some people are trying to argue that it should be. And that's the visceral sensory nervous system. And that's feeling, it's the income of information coming from your organs into your brain. And so some of our applications, I'll reference that again later on as I show you some of the applications that we do in here, because we leverage that quite a bit. We want you to feel your gut. Actually, just a quick one, and I'll forever say thank you, Jennifer Novak, for the Resimax and that introduction. But this is a great little device, and just putting that on your belly button, that vibration going into your gut, again, that's that sensory component. And this device is actually designed to vibrate at frequencies that can really engage that vagal system and that rest and digest system. So if you're having a hard time sleeping, usually I recommend just wrapping this up in a towel and putting that on your bed at the bottom of your feet. And through the night, it will resonate. It just feels like a cat purring. And through the night, it'll be therapeutic all night long. And so it's a really great, simple way to just engage that rest and digest system while you're sleeping. But we use that all the time because we want to engage that parasympathetic rest and digest system while we're doing other kinds of therapies. And so you'll see these around all the time in our office. So just to kind of give you a quick visual, again, this is the brainstem, cut up a little bit more differently than earlier, but we have what we refer to as the brain, the cortex of the brain. These are your higher brain centers. And I know that, I can show this to a lot of doctors and they don't know neuroanatomy that well. So I realize who the audience is, but it's still good to see these higher brain centers, as they activate, they automatically engage that midbrain. Remember the red one? That's that fight or flight region. And I'm oversimplifying here, and I'm doing this on purpose. But as soon as you activate your brain, you activate that fight or flight region automatically. Okay? And then you also activate that blue-green. It was blue in here, but it's blue-green in the other picture, that pons and medulla, that lower brainstem area, right? That rest and digest area. The reason why that activates too is because when that fight or flight goes on, it kicks in everywhere. And then the only way that we can function without being in high stress mode all the time is because at the same time, this other region also engages and inhibits and calms things down, right? And then you have optimal health, optimal function. What if you don't have an efficient lower brainstem? And you may not necessarily present with this posture, right, which I associated with that area. A lot of times it doesn't show that way. It could be more subtle. But what if this area, maybe it's just one side, or in this example, both sides are not working well. What you have is you have this high sympathetic state, this high stress response. And as a result, anxiety kicks in, fear, difficulty sleeping, light and sound sensitivity, high blood pressure, elevated heart rate, poor digestion, poor immune function. Okay? Now, in this example here, we have one side only that's not working. And we can detect these when we take blood pressure on both sides or heart rate and other signs that we look for in our exam. We can find is this really only happening on one side or is it happening on both sides? And sometimes, in many cases, it's just one side. When we may say, well, one side of your brain is not working as efficiently as the other, well, then it will not come down here and engage that rest and digest region called the pons and the medulla. However, what happens on the other side is when you activate that high stress region, that midbrain, that fight or flight region, it feeds both sides. Both sides. So, but this one right here, only one side. And so there you can have a situation where you have high blood pressure on one side, but kind of normal on the other side. That happens. Or we start seeing other signs of these kinds of imbalances. A lot of times we'll see them in the face too, where there's asymmetries in the face, and there's many other signs that we look for. I don't expect you to remember all that, but just to realize that these are extremely common, and that's generally what we look for. So dysautonomia is a general term for a group of disorders that share a common problem. That is an autonomic nervous system that doesn't function as it should. The autonomic nervous system is the part of the nervous system that controls involuntary body functions like your heart rate, blood pressure, breathing, digestion, body and skin temperature, cold hands, cold feet, anybody? Right? That's an autonomic sign. Bladder function, sexual function, and many other functions. So when the ANS doesn't work the way that it should, it can cause heart and blood pressure problems, breathing problems, loss of bladder control, and many other problems. These are, again, just a kind of another list of associated issues. It's a little longer. We'll start from this end. Erectile dysfunction, migraines, difficulty focusing, light sensitivity, difficulty emptying your bladder, bladder control, constipation, diarrhea, feeling full quickly when eating, nausea, vomiting, dry mouth, dry eyes, fainting, sweating excessively or not enough, cold hands, cold feet, difficulty sleeping, anxiety, digestive problems, fainting, brain fog, dizziness when standing, irregular heart rate, high blood pressure, high or low heart rate. Or it could be low blood pressure. I'm going to kind of go through these a little faster so we can get to the good stuff, but there's really 5 types of, we can categorize dysautonomia in 5 different types here. The first one is neurocardiogenic syncope. If you've ever heard like that term vasovagal, kind of presentation, that can happen. It can certainly lead to fainting and conditions like that. You have postural orthostatic tachycardic syndrome. This is the one that we really see a lot of, one of the ones we see a lot of, and we call it POTS. And it's becoming more well known, especially since COVID has come through, because like Dr. Elaine mentioned earlier, a lot of these conditions will begin after some kind of viral infections. And it used to be Lyme primarily, and now it's Lyme and COVID, and there are other ones as well, but those are the big ones that are most common. And then there's familial dysautonomia, and that's where people can inherit this type of dysautonomia from their genetic relatives. It can cause decreased pain sensitivity, lack of eye tears, and trouble regulating body temperature. Multiple systems atrophy is a really tough one. It's a neurodegenerative autoimmune condition, and it's life-threatening. And what ends up happening is you start having autonomic failure in various systems over time. And then there's complete autonomic failure, which are really, really difficult to treat. What is the root cause, really? That's the question, right? That's what we want to know. What is the root cause of dysautonomia? And I'm going to separate it out in 2 different categories. So first, the problem originates in the brainstem, but think of it as brainstem or in the nerves that control them, but also the organs and glands and vessels. So think of it as those 3 different sections. Where's the problem? There's dysautonomia. Is it the nerve that goes from the brain to the organ? Is it the organ that's the problem, or is it the brain, or is it a combination of 2 or 3 of those? And it most frequently is a combination because one system affects the other. But primary dysautonomia is dysautonomia without the presence of other diseases. That's where neurorehab, what we do, really shines. We can't find anything else. Why is it there? We're not quite sure, but we're finding these imbalances within your brain, within your nervous system, and these are the ones that we do the best with. So there's a method that was created here, and I have to give Dr. Ben and Dr. Jose, Dr. Jose is not here today, a huge amount of credit for this. Dr. Ben and I have been doing neurorehab, vestibular rehab for a very long time. And over the years, we keep kind of modifying and adding pieces here and there. Well, within days of being in this office together, it wasn't long until we were able to piece together methods that were many times more effective than what we were doing on our own before. And the gravity reset method is a method that we have named that was born in this office. And we've been teaching since last year. And this is a method where we are recalibrating 3 primary critical systems for the autonomic system to function well. And it's really used for many other reasons as well. But we're recalibrating the brain's, the visual system with the vestibular system and the sensory system together. And the way that we go about doing that is leveraging the part of the vestibular system that feels gravity. If you know anything about dysautonomia, you will know that when you stand up, you don't feel as good as when you lay down. And that's critical to understand because a lot of times, like myself, I've had a very mild, comparatively, form of dysautonomia since I had a concussion in high school. I just didn't know it. But that has led to many symptoms and issues that I had through my life. Well, what happens is that when you go from laying down to standing, the number one system that needs to kick in and help your brain make a change is the vestibular system, because that is the system that feels gravity, and it never turns off. It's always on. It never takes a break, not even for a second. But if that system is not well calibrated, then what happens is that when you stand, you don't have the appropriate cardiovascular response, the appropriate autonomic response. So we have to start there. And it's so powerful that what we've done in this office is that we look at that system all the time, and we make sure that we try to balance that first. Because if we don't balance that first, it's such a critical, high priority system that whatever else we work on, the brain, if it has any kind of implication, and it always does, from the imbalance from that system, if we don't calibrate the vestibular with the visual with the sensory together first, so many of the other symptoms you may have, whether they're structural, whether they're digestive, or whether they're cognitive, whatever they are, ADHD, you name it, they're not going to do as well if we don't calibrate that system first. Same for chiropractic adjustment. I'm a chiropractor. I love to work with the spine. But if I don't calibrate that system first, I'm doing myself and the patient a disservice, because what we're trying to change is just not going to change as well, or it may not change at all. It's that chronic pattern that keeps coming back all the time. In that system, calibrating the gravity reset method is the best thing you could do to allow for these compensations to start unlocking and opening up and healing. Secondary dysautonomia is it occurs as a condition of another diseases, and that's often what happens too with viruses and many other things as well. And we do well in many of those conditions as well, but it's also really important to consider, well, what caused it, right? Can we look at what caused it too? And that's where Dr. Elaine and I have done some work together and have often had to work together on some of these cases to do better. I listed many conditions here. I won't read them all. The slide's been on long enough. But there are many conditions that can cause that secondary dysautonomia. So primary dysautonomia, again, just rapidly, we want to really focus on engaging that lower part of the brainstem and calming down that upper part here for balancing out that autonomic system. So these are cranial nerves. And out of these 12 cranial nerves, we look at those all the time. You don't even know half the time that we're looking at those when we're talking, but we're looking at these because so much of these functions can be seen in the face, in the eyes, and also in posture, as I mentioned earlier. Well, you have 4 cranial nerves that are known cranial nerves to have parasympathetic, that rest and digest kind of functions. And those are the ocular motor nerve, and that's where, when that one's affected, light sensitivity is an issue because its job is to control and to constrict that pupil. When you're under stress, those pupils, they open up, right? And sometimes you may know someone that has a pupil bigger than the other, and you're like, huh, you've got one bigger than the other. I wonder why that is. Well, that system's out of balance. But that's why light sensitivity comes into play with dysautonomias as well. And then the facial nerve, dry eye, dry mouth, taste, motor function of the face. When you see these imbalances in facial muscles, you know that there's potentially an autonomic issue. It could be something else too. I mean, there are peripheral nerve conditions that can happen. And then cranial nerve 9, glossopharyngeal, and 9 together, they're the ones that are really involved in controlling the heart rate. So if you have elevated heart rate, and we see that heart rate really goes up when you stand up, it's not doing its job. Choking, coughing, digestive issues, those are just some of the few issues that can happen when that's weak. And then the lower part of the the lower part of the peripheral parasympathetic nervous system, that rest and digest system, is bladder control, gonad, and genitals. So just have to mention it. You'll see that a lot of times when we use our pulse machine to really help promote healing in the body, we will sometimes even use an extra pad and place it over the abdomen or over the pelvic region, because that's where the nerves, the parasympathetic nerves that control bladder, gonads, genitals, but it's not just that, they give feedback to the autonomic system. So we will often concentrate in that area. And that's one of the reasons why we do that. So standing up is critical. This is one of those things where if you feel like you stand up and you feel a little dizzy, and I know you probably answered some of those questions in your questionnaire, but I wouldn't ignore that. That could be a sign of a potential autonomic imbalance. And it can be mild, but it'd be great to know about it, assess it properly, and address it, if you can, sooner rather than later. But dizziness is a very common symptom as well. And when we do our testing, we test the autonomic system laying down, we test it standing, and we do a couple other things too, like deep breathing and a maneuver called Valsalva maneuver to increase pressure internally. And we do those things to really test how adaptable the autonomic function is. So in our testing, actually, before I dive into that, I just want to do a quick drawing and give away a bottle of Angionox. This cost $94. So one of you guys get to take this home. If you don't want it, please don't take it. Just let someone else take it or give it to someone, but don't let it go to waste. But this is the product that helps. It has arginine and citrulline in it, and quercetin. And this is the product that I was talking about earlier in reference to opening up that blood flow. If you have low blood pressure, you shouldn't take it. But if you have blood pressure issues, this could be a really great one. I like to take that with magnesium every night, an hour before bed, because it opens up blood flow, and magnesium helps to really calm down the brain. So for sleeping, it's really a great combination. So Kendra, can you pull somebody's name, please? I like to give away stuff. So every time I do a lecture, I like to give things away and things that are relevant to what we're doing. Vicky, we have a Vicky here. Okay. Would you like to have it, Vicky? Okay. Thank you. Okay, so testing. This is the testing that I offer to everybody here in the audience. What it's measuring is the R&R interval variability. I know there's a lot of big words that I'm using today, and I apologize for that, but really what it means is the interval between heartbeats, bottom line. But we call it R&R interval. That's a little quicker. And so we're measuring that interval in different states or different conditions. And that gives us and you so much information. So what we're ultimately measuring is the medulla vasomotor center. The medulla is that green part of the brain center. Remember, red, blue, green? I mentioned the blue-green. That area is the area that we really need. We need that area to work well. We really need all of it to work well, but the lower part is critical for balancing out that fight or flight stress response. And so that region through the vagus nerve will then go down to the SA node, which is basically the pacemaker of the heart. You know, we have two vagus nerves, one on each side, and one has a greater influence on heart rate, and the other one has a greater influence on the rhythm. Those details don't matter too much in this context, but it's just to let you know that there is a strong connection between the brain and the heart and oxygenation of your body tissue. So if you go from laying down to standing and your vestibular system is not doing a great job communicating with your brainstem to say, let's bring some oxygen up to the brain, let's bring some more blood up there, what will happen is your brain is not going to get that oxygen that it needs, and then you start feeling a little dizzy, may have brain fog, you may feel like you might want to faint. But if it's not that bad and it's just you're not at the fainting point, you're just at the brain fog point, and you just know, like, I just do not function the way that I think I should. Like, is there something wrong with me? And what's going on? And that's really what we're measuring with that test. So what we look at is the parasympathetic and sympathetic adaptability in different positions. So if you go from laying down to standing, and you don't have to be strapped to a table to do this, but it's the best picture I could come up with. So if you're laying down, and usually we start laying down, and we get our numbers, and then the next thing we ask, okay, stand up. So as you stand, we see how is this system changing? Well, what happens is if you stand and that parasympathetic function decreases when standing, there's an 80% chance that you're going to have digestive problems. And so gastrointestinal problems, when we look at these results, we can pretty much say, like, there's a pretty good chance your GI system is not doing a good job. And so it's really important to work with it, but then I'm going to flip that around too. The other way is, if you're doing everything you can to change your diet and to take the right supplements to help your digestive system and to help heal it, but you have this issue within your autonomic nervous system, that has to be addressed. And this is the part that remains kind of untold, or it's one of those things where you can't just go on any street corner and find a doctor that will help resolve that. But I hope that with videos like this, more and more people start doing the work that we do and basically give that option of, well, there is an autonomic problem that needs to be addressed. So as we're healing your gut, we're also going to do what we can to optimize that system. And so if the sympathetic nervous system decreases when standing, that's that fight or flight system. If that goes down, that's associated with adrenal deficiencies. Now, if you have your adrenals tested and you're like, oh yeah, these are low, let's give them more supplements so they can come up high, but we don't address this issue, it's going to be a tough road, right? So sometimes it can be linked to deficiencies, but if we're not doing anything about that, that autonomic overdrive, that fight or flight system that doesn't calm down, it's going to be like swimming against the current. There will be some benefit, but it won't be quite as significant as it should be. Now, the cool thing is, the reason why the gravity reset method is so powerful is that we can see changes in these systems in minutes. That's how powerful it is. And I still can't believe it, but we've been doing it now, and every time we retest and we check other systems and we realize, I mean, it really works. It still works. It's been working, but it still works. And every time we see these dramatic changes in a very short amount of time that we can record and measure, it's just mind-blowing. And I truly believe that this is the greatest discovery in my career. And again, I mentioned Dr. Ben Barrett earlier. He deserves so much credit for that. I was watching him do some things and I'm like, what are you doing that for? And I was doing different things. And as we came together, you know, that's how these techniques are born. Well, it's that powerful. And then the other one here, when you have the sympathetic system and the parasympathetic that are both decreased, one possibility is it could be, if you're on beta blockers, it could be that you're on a dose that is too high. There are other possible reasons, but these are big ones that are established. So back to POTS, postural orthostatic tachycardic syndrome. What typically happens is when you stand, your heart rate goes up. And that's one of the first things that I check when I do a new exam is I put a pulse oximeter on and I'll check it sitting and I'll check it standing. Are we seeing a change? In the most optimal cases, there's no change. It's not abnormal for it to go up a little bit. Typically, if it goes up a little bit, it should come back down. We're not going to get into the exact numbers of what's normal, what's not, and at which point do you call it a problem. I've tested this too many times to see so many people have heart rates that don't budge when they stand, like nothing. It just stays still. That's how efficient they are. That's great. The system works well. But when it goes up, 10, 20, 30, and really 30 is more of a classic number, but really if I see any increase, automatically I think we've got to test that autonomic system a little bit more carefully and see if there's any issues there. But a lot of times what will happen is blood pressure will drop and your heart rate will go up. That's a common presentation with POTS. And in some cases the blood pressure doesn't drop, but the heart rate goes up. And so there's different categories there where it doesn't always present exactly the same, but regardless, we know that the control of that system is not efficient. And it's extremely common. Now that I test it all the time, I'm seeing so many people that come in even for other conditions, and we find that that system is out of balance. So this is a before and after evaluation with the Nerve Express. The Nerve Express is great. Again, it gives us tons of information. I'm not going to show you the whole test, but this is laying down, means supine is laying down, upright, that's standing, and then we have the average. We won't worry about that one for now, but we have these two systems here. The sympathetic system, that's that fight or flight. So when you get into from negatives to positive, it means that it's much higher in terms of output. Same for the rest and digest. If you go towards the 4 versus negative 4, if it's negative 4, it's not working at all. If it's positive 4, it means it's really working on overdrive. Okay, same for that fight or flight. So when we look at laying down, if we're here, that's where that laying down, that's where it is. In this particular case, it means that the fight or flight system is on number 3 here. It's very high. But fortunately, laying down, you still have that rest and digest system. So it's not good, but it's not horrible because at least you've got some good function in that rest and digest system as long as you lay down. But if you stand up, that rest and digest system shoots way down here, -3. Not a good scenario, right? So there's a lot of different presentations. I want to make you a little bit familiar with how we test it and the type of data that we get. Same person, after some of the care that we do, you'll see that they're completely glued together no matter what happens. They could be laying down, they could be standing, there's no difference. They're all on top of each other. That's really stable. That's a great change. Okay? Now, in this particular example, we have -1 laying down for the rest and digest system, and standing up it goes to -2. But for that fight or flight stress response, when this person stands up, they go from being in a really good place laying down, shooting right up to +3. So what you get is standing is that fight or flight just goes shoo, and you get a little bit of a decrease in the rest and digest system. I mean, there's all sorts of different presentation, and some are very alarming. And this same person, after care, they're right down here. So we could say, yeah, we want that rest and digest system to work better. We really want this to be here or maybe here, but that's still a really great change. They're stacked on top of each other, means it's stable. Now, these are two different people with chronic GI problems, digestive issues. Look at the first one right here. So first thing you think, I mean, these are like double negatives. Everything's down. That's really, really bad. If you're here, like, don't walk away. Don't leave without coming back. Like, we've got to fix this because life is going to be very difficult and very short if we stay here. Now, this is also not such a great scenario, but still concerning because you have very low parasympathetic function. And chronic GI issue, this is someone who's active, who's able to do quite a lot, but with a lot of difficulty. You know, he gets tired through the day, just lots of digestive issues. I mean, that rest and digest system is just really not doing well at all. Fortunately, the fight or flight is not on super high alert, so he can get by. You know, he can make it work, but not well. A lot of the things he loves to do, he can't do them. You know, some of the sports that he wants to be part of, you just have to kind of give it away. Now, here's just different kind of data and screen that we get with this kind of testing. And this is a fitness score. And this is factoring in all the factors that we get with the testing. So what I showed you earlier is looking at just sitting to standing, or I'm sorry, laying down to standing. But this is giving us a lot more information because it's taking in all the data. And it's giving you a score, a fitness score. Top athlete should be right here, 1 to 1. Should be in the blue. This is where, like, as good as it gets, 1/1. This is the normal range right here where most people are and you have good function. If you're in here, that's a great thing. So this score is a 6/4, so 6, 4. This shows good adaptability in different positions, in different scenarios where you're deep breathing or where you're increasing pressure in your body. This is the person that can do what they need to do every day and live a good quality, high quality life. Here is 12/7. The worst score you can get is 13/7. So 12/7 is in the danger zone. There is no way this person is living a life where they can do everything they want to do. It's just not possible. When we see this, there's digestive issues, there's got to be some brain fog, there's got to be some dizziness, there's got to be all sorts of other problems. It's just not possible to be there and not have any problems. But this is alarming. This is, again, this is the person that, you know, don't leave, we've got to fix this because your life depends on it. And I can tell you with this person, this person's doing really well. So we'll just leave it at that for now. This person too. But they were good on the way in. So how do we treat it? Kendra, can I have your help? Now, I'm going to oversimplify it because how we treat it is highly specific to each individual. So we don't have a one-way protocol, boom, boom, boom. We just kind of put everybody through the same kind of thing. But there are some general things that we do a lot of. Is just we may kind of tweak the order or how we approach it from person to person. So the gravity reset method, can you bring the chair in? Just to give you a visual, you'll see this picture up here. The graviceptive system is activated in the brain most powerfully by linear movements. Linear means like if you drive in a car, your body is moving in a linear manner. If you turn your head, that's angular, you're rotating. But linear is just your head is still and you're translating, or you're translating forward, or you're translating backwards. So you're translating. So what we do is we determine how are we going to translate this person to create a change that is beneficial to their autonomic nervous system. But how are we going to do this and also calibrate the vestibular, the visual, and the sensory system together? That's what we talked about earlier. I could have used this model, but he only has a head. So, and you're much prettier than this guy. I want to give you an idea of what it looks like when we do these techniques. So we use an office chair. Raise your legs up. And I'm going to just turn you because when that laser goes on, I don't want to laser you guys in the eyes. Okay. So this is one piece of gravity reset. Okay, just to kind of give you a visual here. But what if we did this and we calibrated the vestibular, the visual system, and the sensory system? And we do this because there's a weighted headband right here. So she's more aware of her head position, where her head is, because it's weighted and there's compression. So that's sensory, right? Sensory, one of the three. Visual, you get laser feedback. The laser's right here. She can see where her head is positioned based on where that laser is. And the vestibular part is going to be the translation. So if I move the chair from here to the right, for example, and it's just a side translation, I'm calibrating, especially, really it's having a benefit on both sides, but we tend to go into the direction of the involved vestibular system that we want to affect. And we can do this in a lot of different directions and different patterns. But now what if we did that and we also added in the Resimax with vibration on the gut at the same time? We're recalibrating that system and we're activating that parasympathetic and rest and digest system. So Kendra's going to hold it right on her belly button. And let's say that we do that and we do a translation. It's very rare that we translate forward, but let's say that in this case, we'll just go to the right a little bit more. We go to the right, assuming it's a right-sided issue. We would do it exactly like that. The reason why we rarely go forward is because we go forward all the time in life. And as you go forward and you go towards object and they come near you, you converge your eyes, and that's associated with more of engaging that fight or flight system. So we do it sometimes, but it's rare. So most of the time you'll see us pull people back, move them to the side. If you have motion sickness in a car, there's a pretty high likelihood we're going to be moving you back and having your eyes either set far away or off to the side, because we want to defeat that convergence dominance where your eyes just lock in too much together. That's a dominance and convergence that's associated with, it happens from the midbrain, that fight or flight region. It's associated with driving up that stress sympathetic response. So that kind of gives you a visual of what that is like. So that's step one in our approach. So step one will be gravity reset always. And then another thing that we can do is use other devices. Kendra, I'll have you stay in the chair if you don't mind. This is called a mini sim. I'll cover that again a little bit later, but I had this one in my mouth. Let me get a new one. Although you wouldn't mind, right? She didn't answer.
Yeah, but it'll look better.
Oh, yeah. I'm pretty sure I know that look. Yeah. All right, so what this does is it, and you'll see it around line 1 there, mini stem. We use this on the tongue. And I just want to kind of show you, and you can tell them what it feels like, but bring your tongue out. I want to show you what it looks like. You see a little contraction. Okay, so the tongue will kind of pulsate. The tongue is very powerful. Actually, there's a device called a Pons device that was created specifically to stimulate the tongue. And, you know, the sensation of the tongue is a function of cranial nerves 7 and 9. Remember I talked about 4 nerves earlier? 7 and 9 were on the list of 4. But, you know, there's also a blinking light on here. So if we position this just right and you have the blinking light on, you're actually doing 3, 7, and 9. So 3 of the 4 cranial nerves are activated that are rest and digest parasympathetic nerves. But what if we did that and had here vibration here, and so if we do those 2 things at the same time. All right, so now that we're doing these 2 together at the same time, we have 2 different modalities at one time that engage that rest and digest system. But we want it to last. So if we do this and we do a translation, then it's really neurons that fire together in the brain, they wire together. So we want to combine these things with other activities so that it lasts. And that's neurorehab. This is established information. It's not new. But what if we did that and we also engage a part of the brain that has the job of engaging that system and it's not doing its job, right? So now we have this here, this on the tongue, and the part of the brain is the frontal region of the brain. The frontal lobe has that great responsibility and has direct link down into that rest and digest region. And we can do specific eye exercises with this and get those systems to sync together again so that you don't have to just live that way, it just does it now, okay? So, and that's a big part of our approach. Do you mind laying down on the pulse machine here? One of the greatest discoveries, and it's nothing that I made, but I just came across it, discovered it, is this technology called Pulse. If you're a patient here, I know some of you have seen this. And so normally what we do, I won't turn these on, but you can keep your shoes on. I'll just kind of show how this goes. But what this does, we would normally zip these up. These are compression sleeves. What happens with POTS is a lot of times your ability to bring blood flow back up your body, up to your brain, is compromised. So a lot of times the blood will just pool in your lower body or in your legs. After we do a lot of our applications, and we change the order here and there when it's indicated, but it's really great to do this as part of your visit where the legs are elevated higher than the heart, and the machine pulses magnetic energy through the body to optimize healing of the cells. Brain, heart, everything exposed here will have a concentration of magnetic energy to recharge the cells. The cells in our body have a charge, and that's why when we do an EKG, you measure electrical activity of the heart, EEG of the brain, EMG, electrical activity of muscles, right? There's electrical activity in all of our cells, and if that charge becomes too high, too positive, then it starts looking like a cancer cell. Ideal charge is -25, and a cell requires double its charge, -50, in order to really function at its best and to heal. And so, unfortunately, we have a lot of exposure to all sorts of electromagnetic field, EMFs. This is different, but you think of Wi-Fi, you think of 5G, and you think of all the electrical devices around us. our body takes a hit every second that we're exposed to those. And what this does is it gives you the ability to recharge your cells and handle all of that. And so we've had great success adding that in as well. And one other component I mentioned earlier, but just so you can see it, if I plug in the whole bed and I plug in another piece like that and I just put it right here, it will concentrate a lot more of the energy through and out this pad. So all the gut and digestive organs, reproductive organs, all that nerve supply, all that sacral nerve supply that engages that, the lower part of the spine, the sacral, which is your parasympathetic output. It's brainstem and it's sacral. It's those two ends. And so we're kind of augmenting energy there in that area. So it can be very, very impactful. I see Les is here. Les created a device called Z-Tech, and Z-Tech is I know I won't do it justice, but we'll call it a STEM device that I have good colleagues, good friends that will put leads on the sacrum, on the tailbone, to activate that parasympathetic nervous system as they're doing other things for dysautonomia. And the cool thing with that is you can move around with it. Obviously, we're not going to move around with this. So there's all sorts of things that we can adapt, differently. So I'm not going to turn it on, but thank you, model. Okay, so some of the other things that we'll do, okay, I mentioned all these. Okay, let's go to level 1, okay. Level 2, not yet. Gravity reset, we talked on that quite a lot. Just to kind of give you a quick visual, so before I go on level 2 types of exercise for dysautonomia, there's 3 levels. I made them up. It's just in my head. I think that way. I got level 1, we're doing this. When you reach a certain point, we go to level 2, then we go to level 3. But for gravity reset, what it comes down to is to have good posture, good movement, good balance, and good stability. And more, right? Proper autonomic function. You need the visual system, the vestibular system, and the sensory system. They all need to work together, okay? It's very hard for you to have an accurate representation of where you are in space and where things are around you if those 3 systems are not speaking the same language and telling the same story. They have to be synced together. And I have played around with those systems for decades. I've been in practice more than 20 years, and I can tell you that in order to successfully allow these to work well, and to really answer that question of where am I in space? Are you connected? Do you feel connected and grounded? I guess that's probably a better way to say it. Do you feel grounded? Because when these systems are disconnected, you don't feel grounded. Athletes are not in the game. When they're in that place where everything is just clicking perfectly. That can only happen if these systems are perfectly in sync. And so, it has to be done together. I did this by itself for many years. I did that by itself for many years, and this by itself for many years. And it helps, but it doesn't work as well as if you integrate them together. Level 2. Okay, so level 2 exercises have to be laying down. So level 2 means we're going to now build endurance. We're going to get you to exercise because we're seeing some great change. Your autonomic system is becoming more balanced, but that's in a perfect condition in our office, in closed rooms, right? No disturbance of any kind, no kind of challenge of any sort. And so we need to start building endurance in that system. And that has to happen. But it has to happen laying down first. And if you start looking online for devices like this, you're not going to find them. Well, you can find the pedaler there because that's one of those pedaler that you can put under your desk and pedal while you're working kind of thing. But there's no bike that's a true, fully laying down bike. We made that. So we made that here. And that's one of the things that I love about our clinic here is we have a lot of creative clinicians here. If we know we want to do something and there's nothing out there that can do it, we're just going to make it. And there's a number of the devices that we have here, devices that we have created. And so this bike is a supine bike. So we start laying down like this. What you don't see in that picture is we would often use the Resimax at the same time. You know, those straps there are used so we can do isometric exercises with the upper body. But most of the time when we have patients pedaling, they're doing this here with the Resimax on their abdomen. It's simple, it's easy. And that way we're engaging that rest and digest system while we're doing a cardiovascular exercise in a laying down position. And laying down because, as you know, right, I mentioned before, most of the time you'll see a huge difference laying to standing. That's how we find dysautonomia. You change position and you see these imbalances that are not acceptable. And so the ultimate goal is to be standing on this machine. This machine has a platform that moves. It's a moving platform. I mean, when does the ground move on you, right? It's not common. And you have this column that goes up and down. And it's a really cool machine because ultimately what that is, I'll use terms that you may not be able to associate with just yet, but it's midline and it's cerebellum conditioning machine. Midline meaning in the brain, there are structures in the center of the brain, like the brainstem, right? We talked about the brainstem a lot. Brainstem is midline. Other structures that are midline are going to be the legs, because the part of the brain that controls the legs comes from the center of the brain. The arms are not midline. They're controlled by regions that are on the outside of the brain, but the legs are in the center, midline. And so that's why when you lay down, we use the legs. We do conditioning exercises, pedaling with the legs. When you're standing, we want to have the floor move so that your legs and your brain has to constantly respond to a moving floor. And we want to engage with the arms because as you are pressing or pulling, you have to keep your numbers still and stable while everything's moving. It engages your core. This is the ultimate core strengthening machine. And so, of course, pro athletes use this in various sports, but in here, that is the ultimate goal. Is for level 3, the final step is you want to be able to get on there, you want to be able to get really great scores, and to be able to walk out and be like, no problem, I'm good. That's the goal for dysautonomia. Okay? There are other conditions that we would name, like anxiety, for example, that are a result of an autonomic imbalance. And so anxiety is basically that midbrain being on fight or flight, that fight or flight region being on overdrive, and not enough activation of that pons and medulla, that rest and digest region. And so for anxiety, you'll see here I've got that mini stim on the tongue, and I also have the stim pod on my abdomen. So that way we're activating that parasympathetic system. While I'm doing right here, I have the headband on for improving head awareness. We could do it with or without, but it's better with. And then what I'm doing here is an exercise where a target appears and my eyes have to look opposite of the target. Okay, and it's random, so you never know which side it's going to appear on. That forces you to activate the executive part of your frontal lobe, which has the responsibility of engaging that rest and digest, blue-green part of the brainstem. It's the responsible party. So we're combining all of that all at once. So this is, if I were to say, if I know nothing other than you have anxiety, I would say, let's do a gravity reset and let's just do a whole lot of that. And there's a really high likelihood that it's going to help significantly. Now, we're better than that. You know, we look for how do we need to individualize your care and make it more specific to you. But in general, this works really well. I put up here OptiMag Neuro. That's a magnesium for the brain. There's different kinds of magnesiums. I love this product. The brain has a magnesium plug meaning the brain needs magnesium to plug neurons so they don't wind up. If they wind up too much, it's really hard to shut off your mind, it's hard to go to sleep. So especially with anxiety where you have just this really high output of stress, magnesium is a really important one. And I have it here for a lucky person in the audience. Dr. Elaine, you want to pick it? So Optimag Neuro is just great for that. This is my favorite for sleep. I'm not saying that if you have trouble sleeping, this by itself will help everybody. It helps the majority of people. And many times you've got to do some of these other things as well.
Barbie.
Barbie? Okay. Would you like to have it? Okay. Okay, some other conditions. I talked about high blood pressure earlier, so that combination of these two, that Anginox and Optimag work well. But we've got to do gravity reset. We've got to do the work we need to do to balance out the midbrain and the lower brainstem. Yeah, talked a lot about that. The Anginox, again, produces nitric oxide, which is one of the critical neurotransmitters essential for relaxing smooth muscles. So the way you breathe is actually really important for producing nitric oxide. You don't just have to take a supplement to produce more. You can change the way you breathe and produce more. And to do that, you want to breathe through your nose. If you're used to breathing through your mouth, and especially when you sleep, you want to try to condition yourself to breathe through your nose. And if you do that, when you nose breathe, you will produce more nitric oxide, but when you breathe through your mouth, you don't. And so one cool thing is there is some work that's been done many decades ago on breathing techniques for lowering blood pressure. Dr. Buteyko is one that I'm familiar with. I first heard about him 20 years ago, and he would basically go teach, well, he did studies basically for blood pressure and found that by changing your breathing and really optimizing nasal breathing, he could lower blood pressure. But what he also found is the majority of people who had asthma were getting better. So, and the reason for that is that nitric oxide helps smooth muscles relax. So as you relax smooth muscles, it's not just the arteries, it's also the airways in your lungs, and so it optimizes for better breathing as well. And another topic we're not going to discuss too much today, Viagra. You ever heard of it? It's a drug that's used for nitric oxide pathway. Basically, this Anginox and producing more nitric oxide could have very similar benefits. So I talked a lot about the brain and the nervous system, and I don't want to say that it's the only thing that should ever be addressed in every condition. Of course, in many instances, a huge cause for depleted energy comes really out of the gut, so digestive health is critical. I really do think that healing and optimizing healing and balance within the autonomic control is critical and should be done as early and soon as possible. However, sometimes we also need to go in and help the gut repair. And so we have I use a 90-day gut repair program, and it really consists of 3 different products. Just to kind of give you again an idea of what we do, but basically for the first, well, day 1 to 90, I like to recommend this probiotic, which it really at the origin comes from human strands, and so it's human bacteria, but they're full spores, meaning they're not going to get denatured in your stomach acid. They will be protected through, and I have many patients that take it and have had tremendous benefits. So it is important even within dysautonomia to also heal the digestive tract, because it will have an impact. There is a sensory feedback to the brain, so we want to really work with the whole system as a whole. And then we can add in other product like a prebiotic and then mega mucosa to support proper healing and reinforcement of that barrier in our gut. That is the first line of the defense for our body. And I'm going to give all three of those away right now. So can we have Dr. Elaine, you want to do the drawing again? You're close, so yeah. So the value here is quite high, but
Miss Margaret.
Margaret Verna. And would you like to have it, Margaret? Okay, I asked because I don't want to give it away if you don't want it. You had what?
I found out how good this was.
Oh, when you stopped taking. Oh, okay.
It wasn't on purpose. And then I was like, oh my God.
Yeah, and then now you can take everything in there. So those are the other ones. So yeah, Margaret's someone that I know, and she has been taking the probiotic already. And she said that when she stopped taking it, she noticed how great it was because she got to experience the difference. But we'll talk some more about how to take the other ones. Yep. So I can't really just highlight one product for dysautonomia, but I'm going to highlight just one product for dysautonomia because this is a critical one. The B vitamins are really important, but the methylation cycle is really important. More big terms, but methylation cycle is a cycle that happens in every cell in your body to make energy and to promote detoxification. And the reality is that more than half the population has a methylation cycle that has genetic mutations. In other words, that cycle is not working well. And so supporting that cycle can go a long way in helping the neurological system. But as you can see, the decent list here promotes more than that: detoxification, neurotransmitter production, hormone metabolism, histamine metabolism, DNA genetic expression, energy. It supports cardiovascular and neurological health, supports and maintains healthy homocysteine levels that are already within normal range, supports healthy methylation of estrogen, dopamine, epinephrine, heavy metals, and environmental toxins. There's really more to it than that. Depending on which part of the methylation cycle is not working well, it could predispose you to certain cancers like breast cancer or prostate cancer, or maybe more neurodegenerative conditions or cardiovascular issues. This is something that can be tested as well. I'm sure Dr. Elaine does a lot of testing in that area. So, but want to mention that there are some things out there that you can take to help support that system. Most of the patients that I see that have dysautonomia, I will mention that and recommend it as well. So in closing, I'd like to offer all of you a gift. If you haven't already signed up to have an autonomic test done for free, the sign-up sheets are in the back. They will stay there till everybody's gone, but if you want to do this now, you can get up and do that and just find a time slot that's open and that works for you. I want to thank you for your time and thank you for being here today. But I also want to give you the chance to ask questions because in some of these things that we've covered, it may be a bit much information, but if I wasn't clear about one thing or another, I'd like to give you the chance, to ask and be happy to answer questions. Your voice might be on the recording if you answer questions. We could talk after if you prefer. Any questions? I'll go with you first.
So how long-lasting is the effect of the treatment? I mean, is it a maintenance program, or you said some things are like...
So the cool thing about the brain is that once the brain engages a pathway and that pathway is reinforced, it will keep using that pathway in everything that you do. That's really encouraging. On the flip side, if the brain detects that a pathway is weakened, it will avoid using that pathway and start using compensatory pathways and reinforce them. And that weakness will not get better. And so we have to be intentional about engaging that system carefully. And that's why, I kind of highlighted 3 different levels. because we want to condition it, we want to challenge it, but we want to do it in the right order and the right timing, and that timing is different for different people. But eventually you get to a point where you're engaging those pathways and they keep reinforcing as you just do your everyday life. I do think that it would be good to still get checked periodically just to make sure that everything's in order. And that goes for everybody here who's a human. You know, I get myself checked. You know, in here we have the benefit of working with a team that is in this field, and that's a great benefit. But really, you should ideally get checked neurologically periodically. You know, I'd say I encourage people to come in monthly at the very least, but you can very well go a whole year, and at the very least, if things are great, get rechecked in a year, make sure everything's good. And that would be, I think, would serve you well. Yeah. Oh, Dr. Elaine?
I have a question. One of the things, I really love that you added some supplements to your discussion. One of the concerns I usually get is when people go into a vitamin store with really good intentions, but they could be taking a supplement that could stimulate the sympathetic nervous system and causing that fight or flight too much. What supplements do you find that people shouldn't be using that could do that?
Thank you so much, Dr. Elaine, for asking that question. So we have the house expert on the topic asking me how to avoid buying the wrong supplements. So that's my way of throwing this right back at you. But that's a great question, because honestly, there are loads of products out there. And especially if you buy something online, you just don't know, you know, I mean, it could be in a store as well. You don't know, like it may have a label that says it has what it has in there, but does it really have what it says that it has? And everything that we use in here, and I'm sure the ones that you also recommend, are basically they're pharmaceutical grade products that are only sold through doctors. And sometimes you'll find these products online sold on Amazon, but it's actually illegal to sell them online. So those Amazon store or online stores that sell these products, they get shut down really quickly, or they're only up as long as they have a supply, because there's a team on all of these companies have people who are constantly looking, okay, who's selling our stuff, you know, and then they can link them back to an account, and then they close it out. And that's because they want to ensure that, you know, the products, they come with recommendations, but it also, sometimes you should or maybe you shouldn't use something. If you have dysautonomia, you're not getting care, you're not seeing someone, taking these supplements on your own is not going to fix you. So that's my best shot at answering your question. But
That's kind of where I was going with that, because you taught me something I'll never forget a few years ago. You said for my patients too, and for myself, not to take things to stimulate the sympathetic nervous system.
right.
It's so important.
So there's Dr. Elaine said sometimes you can take supplements that are really great supplements that maybe you need, but if you take them at the right time, it might overstimulate a part of the brain that's overactive. And where maybe neurologically we need to bring about some balance before we bring it into the mix. And that's where it gets tricky, because we don't get it perfectly right every time. You know, a lot of times you just need to respond and see, okay, well, we try this, it's not working, let's work through it, and maybe we need to make a change, reintroduce this later, that kind of stuff. Yeah. So Dr. Elaine and I have known each other a long time, and so we've had these kinds of discussions over many years. And I'm sure you'll be presenting in here too, right? Yeah. So we've got a lot more great topics to come. So stay tuned on that, because I'm looking forward to Dr. Elaine's presentations as well. Any other questions?
When it comes to children, should we be, as parents, looking for signs on this type of thing and bringing them in to have you check them?
Yes. So when it comes to children, that's the question. You know, are we looking for specific signs? What are the signs? Should they just come in and have them checked? So this, I'm glad you bring this up. I have 3 kids, and you know, I'm not always really quick to look at my own kids and see, do they have these issues, right? They're functioning pretty well, but they have these issues many times. And sometimes I'm a little late to just, you know, when I'm home, I don't have my doctor hat on. I just try to let it go because it's, you know, what we do is hard. I love it, but it's hard because every person we see just requires a whole lot of brain power, right? We're always thinking about what are we missing constantly. And there are days where I'll see 30 people, you know, or 30 complicated cases. And that's a lot of cases, you know, for the type of setup that we have and for the kind of work that we do. And it's very demanding. So when I go home, I take that hat off and I really try to keep it off. But sometimes these problems keep coming back and it's like, okay, really, there's something in your face that has to be addressed. You work with it all the time. And I brought my kids in here and have done some of this work. And my son, who's 10, is probably the best example of that. He's a hockey player. I mean, he can jump and do flips and all sorts of things. But he's a picky eater. So obviously there's some kind of digestive, autonomic issue there. And, you know, when I recently tested his balance, I test balance all the time as a first clue, like, do we need to work with that, you know, reset that gravity system? He couldn't stand on it. I mean, he's the one that's flipping on trampolines. He couldn't stand on a balance pad. He had this huge, like he got pushed off. He's a hockey player. He runs. He does all sorts of crazy. He's a high-performing kid. He couldn't stand on a balance pad. So obviously there's a problem there. And this system is critical because it has a direct influence on the autonomic function. So yeah, I think it's important for kids to get checked. I have other patients that bring their kids. It's not something that I necessarily talk about all the time, but this is a great opportunity for that question. So yeah, I think just at least having a gravity check, you know, the gravity reset method can be very powerful for kids. If they have known symptoms, they have known digestive issues, focus issues, and other kinds of problems, then they may need more help. They may need Dr. Elaine's help. But I think balancing that graviceptive system first is a great start. Any other questions? Yeah?
I have started developing bouncing blood sugar, not blood sugar, blood pressure, high, low,
Mm-hmm.
and I feel terrible, mostly with the low one. But because I'm now checking myself a couple of times a day, I see that I'm too high.
Mm-hmm.
So
Yeah, so the question is in reference to like a blood pressure that can alternate a lot, go from high to low, and I can't give you just like that, this is why, but I think it would be great to test your autonomic system and see what it gives us, because that's step one, is see what is your autonomic function like in various states, and that'll give us the first path to, okay, what can we do about it based on the information we gain from that test.
So there should be a way that my body balances it out on its own without me having to check through.
It should be a way to stabilize it, but we need to find out what's the best way to help it. Well, one, is it possible to help it? If it's possible, what do we need to do to help it, to recondition it?
Okay.
But it'll start with the test. Yeah. Okay. One more question?
I've got gout.
Mm-hmm.
And this will just help anything without me having to take a drug every day to keep it from flaring up all the time.
Yeah, so I would, first thing is, of course, gout is strongly affected by the types of food that you eat. And I would recommend you talk to Dr. Elaine before you leave. But at the same time, it's also, I would say, not by itself, but I would say it would be great to see what your autonomic function is like, because I would say the majority of inflammatory conditions, if you've got an autonomic imbalance, inflammation will happen much more easily. But with gout, and you want to try to limit those oxalates and avoid certain foods. I would basically say, of course, try to eliminate the things that create too much buildup of oxalates. You could just, well, not everything, but there's some top ones. What I am against is you have a problem, let's just take a drug that helps to mask it and leave the problem there and not address it, because then you're guaranteed that it's just going to get worse. Maybe not symptom-wise, but you're just growing a problem internally that will then start spilling over into other systems. So, but I would say talk to Dr. Elaine for sure. I'm sure she's got lots of great tips on that. Okay, thank you all for being here. I'm sorry if it went a little long, but I appreciate you very much. And I'll stick around if you have other questions after the talk.